In the weeks following delivery, the changes of pregnancy are gradually reversed as the body begins to return to its non-pregnant state. The amount of time required for this process varies depending on the type of delivery you had and other associated medical conditions. The first 6 weeks following the birth of your baby is called the postpartum period. The normal changes of the pregnant uterus to accommodate a developing baby are not reversed overnight. During pregnancy, the uterus increases approximately 11 times its non-pregnant weight. After delivery of the placenta, the uterus is about the size of a grapefruit and can be felt just below the umbilicus. It weighs around 2 pounds immediately after delivery. In about 6 weeks, the uterus will return to its normal weight, a mere 2 ounces.
And are you feeling okay? Are you comfortable the way you are? You can always tell Dad, hey, give me the pillow more up here, and also when she's latching on, when she opens her mouth, you want to bring her head towards your breast and not lean into her, okay? Because you want to be comfortable.
For me to start cramping?
Yes. It's very normal because you're producing a hormone called oxytocin, and that helps a lot with your...
Some women will notice afterbirth pains that feel like menstrual cramps. These cramps are the result of the muscle of the uterus contracting back to its pre-pregnant size. They are beneficial in reducing blood loss following delivery and may be pronounced during breastfeeding. If you have stitches that cause you discomfort, you may soak in the tub or Sitz Bath for 15 minutes 3 times a day. Apply anesthetic spray or ointment that your healthcare provider has prescribed as needed. Do not douche, use tampons or vaginal suppositories until your healthcare provider has given you the okay. Call your doctor's office when you get home from the hospital to make an appointment to be seen about 6 weeks after delivery. If you had a cesarean birth, remember you're healing from major abdominal surgery as well as from childbirth. Your healthcare provider will want you to take it easy and will provide you with instructions for when you get home.
Your C-section with your incision. Make sure you look at it in the mirror. When you take a shower, just let the soap and water run over it and pat dry it. Do not rub it. Also look at it. If it starts to look like a cut that's infected where it's red, puffy, pus, drainage coming out.
Keep your incision clean and dry as instructed by your healthcare team. You may have constipation and gas pains at first. Walking, light exercise, drinking plenty of water, and eating high-fiber vegetables, fruits, and grains will help. Please call if you have a fever or your incision becomes red, swollen, tender, warm to the touch, or if it is draining. The drainage from the birth canal following delivery is called lochia. During the immediate few days after the birth, the discharge is like a menstrual flow. In 3 to 4 days, the discharge becomes more watery and pale. By the 2nd week, lochia is thicker and more yellow in color. Finally, after 4 weeks, the discharge decreases to a minimum as the uterine lining heals.
Okay. Do you have any other questions for me or anything?
Yes, ma'am. I'm having some hemorrhoids. What should I do to take care of that?
Well, hemorrhoids is common, especially when you're pregnant.
Okay.
And pushing can cause them to get aggravated. So one of the things we do is it's called a Sitz Bath. You can use that a couple times during the day. Make sure that you can go to a drugstore and get yourself Tux pads and use that in the area to relieve some of the soreness.
Showers are usually fine as soon as you can walk after delivery.
And every time you go and use the restroom, urinate, make sure you fill this up with warm water. Okay, not too hot. Make sure you check it with your arm or with your hand. And just open it up and then just make sure you clean all down the area, okay? And pat dry.
It's no surprise that the most common complaint heard from new mothers is that they feel so tired. There are several reasons for the extreme fatigue following delivery. Women do not sleep well late in pregnancy and are further exhausted by the physical work of labor. Excitement and many visitors further compound the problem. Hospital surroundings and routines, along with the physical discomfort, can make it difficult to rest. Once you are home, make it a point to rest. Sleep when your baby sleeps. You probably will no longer be able to enjoy 8 hours of uninterrupted sleep. Try to look at resting and napping as a priority rather than a luxury. It is so important to sleep when the baby sleeps for the first couple of weeks. Getting enough rest is necessary to give you energy. Feeling tired is normal after giving birth. You are adjusting to new responsibilities at a time when your hormone levels are adjusting from pregnancy to a post-pregnancy state. Ask for what you need.
I'm the registered dietitian for the hospital, and I just wanted to talk to you a little bit about your diet for where you go home so you'll have enough energy to take care of your new baby. Especially when you go home, a lot of women try to do immediate weight loss, but we want it to be more gradual. We want to make sure that you're getting enough calories, enough energy so you're able to take care of your new baby. Even if you are bottle feeding, you don't want to have a dramatic weight loss at one time. About 1 pound a week is what you want to try to do, 6 small meals per day, and then still take your prenatal vitamin, just so that way your body can recover a little bit faster and you have all the vitamins and minerals you need. And same thing with you, Dad, making sure that you're getting enough water, same thing, so having those meals per day so you have enough energy to help out Mom later and change all those new diapers.
Your diet should be balanced and contain the appropriate amount of calories and nutrients in order to fulfill these special needs. Choose food and beverages low in added sugars. Added sugars contribute calories with few, if any, nutrients.
And also for breastfeeding moms, you want to make sure that you're getting extra calories per day. So you're getting enough nutrients to be able to produce breast milk and feed yourself as well. Adding small snacks, 6 small meals a day is a great way to be able to do that. Have peanut butter, nuts, low-fat cheeses are a really great way to be able to sneak in those extra calories to help you get through the day and have enough energy to take care of your new baby.
Every day you will feel stronger and stronger. Your healthcare provider will give you the go-ahead for when you can exercise and may give you simple exercises you can do the first couple of weeks after birth. Very light exercise is a good way to stimulate healing and get you on the road to regaining your pre-pregnant strength. Try to keep good posture while walking, standing, or sitting. This will stretch your muscles and help you feel better. Movement may be difficult at first, but keep trying. The results will be worth it. Notify your healthcare provider immediately if you are experiencing any of the following: bleeding that soaks a pad every hour for 2 hours, foul odor coming from your vagina, fever of 100.4 degrees Fahrenheit or higher, unrelieved incision or abdominal pain, swelling, redness, discharge, or bleeding from your cesarean incision or episiotomy site. Your incision begins to separate. Problems urinating, including inability to urinate, burning while urinating, or extremely dark urine. No bowel movement within 4 days of giving birth. Any type of visual disturbance. Severe headaches, flu-like symptoms, pain or redness in one or both of your breasts, pain, warmth, tenderness, or swelling in your legs, especially the calf area, frequent nausea and vomiting, signs of postpartum depression, chest pain or problems breathing, please call 911. The time has come to start your new adventure as a family. As a new mother, you will feel joy, fear, confusion, exhaustion, and love. The intensity of feelings after having a child cannot be compared to any other life experience. Once you are home from the hospital, you may start feeling sad or weepy. This is what is known as the baby blues. You may encounter impatience or irritability, and even crying for no reason. These feelings generally come and go quickly, but can be hard to understand. It is attributed to a radical shift in hormone levels, physical, mental, and emotional exhaustion, with a combination of sleep deprivation typical of parenting a newborn. However, as many as 1 in 10 women experience emotional symptoms known as postpartum depression. Postpartum depression may start as early as the 2nd or 3rd day after delivery, or take several weeks or months to develop. Many of the symptoms of baby blues are present, but they are more intense. It is so important to realize that these symptoms are not signs of weakness or inadequacy. Postpartum depression is a real condition, and help is available. Please contact your healthcare provider immediately if you think you are depressed.
Baby blues are a very common portion of the postpartum period. What moms need to understand is that this is not an inadequacy of them as a mother. This is just a change in their hormones related to the postpartum period after delivery. This normally only lasts for a few weeks and starts a few days after delivery and ends shortly thereafter. However, on occasion, it does become more severe, and feelings of wanting to hurt your baby or hurt yourself, or feelings of not wanting to be around other people do become involved. We do recommend in those instances that you contact your obstetrician or your primary care provider immediately. There are many things that can be done for postpartum depression to help you enjoy your baby.